Hi, I'm John Leonard, interim chair of the Weill Department of Medicine, and I want to welcome you today to our Vitals video series. This is a chance for us to get to know members of our community here at the Weill Department of Medicine. And my guest today, I'm really excited to talk to Dr. Matthew Simon, who is in the Division of Infectious Diseases. It's a great chance to get to know him a little bit better and talk to him about his activities here at Weill Cornell. Matt, I've known you for a long time. It's great to have you here. And I know you've had a very important role as well in the hospital epidemiology area. And many people I know seeing this spent a lot of time listening to you, learning you. You taught me how to don and doff PPE during the early days of the pandemic. So I'm sure you're well known to many people, but it's great to hear about how long you've been here and kind of what's your day-to-day activities at this point. I know probably a little different than it was a year or two ago.
Yeah, thank you so much for inviting me. It's great to be here. So let's see, I started with the department back in 2006. So 17 years ago now as an intern and did my residency here. I worked as a hospitalist for a year at Montefiore and then came back to Cornell in 2010 to do my ID fellowship. And I've been on the faculty here since 2013. And I have a few different roles in the department. I'm clinically active on the ID consult service as well as on the hospitalist service for several weeks out of the year. And when I'm not on service, I'm one of the hospital epidemiologists here at NYP Cornell. And for the last 3 years, I've been the program director for our infectious disease fellowship. So one of the things I really love about my job is that I get to do a lot of different things every day, from seeing patients in the hospital to thinking about hospital policy and working on hospital policy to helping our trainees with their career development.
Well, that's really great. What got you excited about hospital epidemiology? I also like doing different things, and I share the idea of kind of switching around from role to role or activity to activity. But in particular, maybe just tell us, what is hospital epidemiology and what got you excited about that part of things?
I think one way to think about it is it's kind of like the public health department or the CDC for the hospital. That was really what kind of got me into the field. During my ID fellowship, I've always had an interest in public health, and I had some exposure through one of my mentors, Dave Calfee, who's in the department, and really inspired me. And I had the opportunity to do some work at the New York City Department of Health. And really feel like this hospital epidemiology role kind of combined clinical medicine and public health. And I think, one of the big responsibilities is trying to translate public health guidance from the health department or CDC kind of into practice at the hospital setting. So kind of really having some understanding for how our own hospital works and how to make sense of those policies and actually try to implement them in the hospital. So I really like that part. I felt like it's a way to have an impact kind of beyond the individual patient level, but to think kind of from the big picture about the hospital. So that's one of the things that excited me about the field.
It seems like in the role you also interact with a lot of people, really different jobs. I think many of us are used to kind of dealing with a few different people in a few different roles, but it sounds like really everywhere in the department, in the hospital, lots of other departments too, you're really kind of educating and interacting with and teaching with people in lots of different roles.
Yeah, I think that's a great point, and it definitely has kind of opened my eyes about kind of this whole ecosystem of the hospital that we don't really think about necessarily on a day-to-day basis, from what's happening in the laboratory, thinking about how this policy may impact the environmental service workers in the hospital, how's how do we keep the water safe in the hospital? Of course, our nursing staff, but you know, you're right. It's really kind of spans all different both patient-facing and non-patient facing departments throughout the hospital. So it's a really cool perspective, I think, on how the hospital operates and functions.
Do you have any questions you want to ask me about anything about the department or anything at all?
Yeah, I think one thing I've been wondering, I know the new dean was announced in September, Dr. Harrington, and I'm curious how you see that impacting the department and what your thoughts are on that.
Yeah, well, I think we've all been fortunate to work with a number of outstanding deans over the last several years, all of whom have had a great impact and kind of a stamp on the medical college and an impact in different aspects of the medical college. And I really think Dr. Harrington is, or Bob, he's very informal about that, at least from what I've seen. You know, Bob is very, I think, likely to have a major impact as well in his own way. He has been, and so I think from the perspective of the Department of Medicine, he's coming to us from Stanford, where he has been the chair of the Department of Medicine. So I think he will have a lot of insights into the department and great ideas and suggestions of how to make us better and more successful. And I expect he'll be very supportive of the department and the things we want to do, as well as the medical college and its collaborations with the hospital and elsewhere. So I think he will have a great impact. I think people will enjoy getting to know him. I think he has his own perspectives and experiences. He's an excellent communicator. He's on Twitter and has a podcast and other things, so people can go learn, you know, more about him. But I've had the opportunity to be part of a couple of meetings with him so far, and I think people will really enjoy getting to know him. And I think he'll have, in his own way, a very remarkable impact on us. So I look forward to working with him in the future, and I think it'll be great for all of us in the department and in the medical college to benefit from his wisdom and his energy. So look forward to that. So before we wrap up, give me a personal fact or two about yourself that your colleagues will be surprised by. They won't know about in advance of seeing this.
Sure. I think one thing that people may be surprised about is I before COVID, I was a competitive table tennis player.
Wow.
Since I was a kid, since I was a teenager, I've competed in both some national and even international competitive table tennis tournaments. So that's happy to talk more if anyone's interested.
Wow. Do you still play a lot? And I know in New York City there are some places around where there are some pretty competitive matches you can get. There's
great places to play in the city. I'm very rusty the last 3 years, and with 2 little kids, I have not gotten to play as much as I would like, but definitely it never goes away. So I definitely want to get back into it.
That's good. Well, I've had the chance in some of my various roles to have like social events for our teams in bars or places where there's table tennis, and we always end up with some competitive matches. But I know to be very careful if I encounter you, and certainly don't want to put any money down on that. Not that I'm that good of a player, but it's a fun sort of thing to watch and to play in some things. So that's great to know. Good to learn that about you. Didn't know that. So
it's great for wellness. Would be a great addition to the house, the resident lounge. Definitely worth considering.
Okay, well, if we can find a space, I'll take that under advisement. Great idea. All right, Matt. Well, thank you so much for joining us and for the chance to get to know you a little bit better, and for all you do for our department and our institution. And look forward to our audience. Look forward to having you join us for future episodes of this series. Thanks very much.
Great. Thank you so much.